Hi everyone, Dr. Emmy from Pain Free and Fit. Today, a great tip for those of you with spondylolisthesis in the lower back, how to train legs without aggravating the mechanical problems that cause spondylolisthesis pain. We're going to look at leg extensions in a modified version to help spare your low back. Hope you enjoy. So many people get out of the gym and they wonder, why is my spondylolisthesis lower back pain irritated? Was it this exercise? Was it that exercise? They're not sure. Sometimes the pain is not irritated to the next day or even 2 days later. Knowing how exercise and movement in general and your typical movement patterns and the exercises you choose affect your spondylolisthesis pain is a key ingredient to helping to decrease the recurrent irritation of your spondylolisthesis and thus promote healing in your low back pain. Today we're going to talk about the leg extension exercise, a seemingly innocent exercise for low back pain sufferers that most trainers and doctors will not tell you is involved with spondylolisthesis, but in fact very much is involved in spondylolisthesis. Remember, each case of spondylolisthesis is unique. We all have unique posture and movement tendencies that are inherent to the way we've learned to move, certain muscle imbalances that have occurred over lifetime, and these create mechanical stresses that stress the disc, the ligaments, facet joint capsules, tendons in our lower back associated with spondylolisthesis that aggravate pain. So learning how to train or develop an exercise program that helps to balance out those imbalances and promotes good spinal stability is very important for spondylolisthesis sufferers. You may need to engage your left multifidus. You may need to relax your right internal oblique. You may need to shift your rib cage to the right or left. You may need to engage more glute action or decrease latissimus action to decrease the mechanical stresses that are feeding into your lower back. However, despite whatever your unique problems are, and again, you can find that at the painfreeandfit.com website, the Fast Track program for spondylolisthesis describes how to do a body analysis on yourself, and there is a free body analysis at the website, painfreeandfit.com. Today we're going to be talking about a very common part of the whole mechanical complex for most spondylolisthesis sufferers, which is the anterior pelvis. Most people with spondylolisthesis pain, most of my spondylolisthesis patients that I've had over 33 years of clinical practice, as well as my online clients around the world, do have an anterior tilted pelvis where the pubic bone is slightly lower than the tailbone, and it's increasing the arch of the lower back and causing the base of the spine, the sacrum, to tilt forward to allow more of an anterior or forward slip of that spondylolisthesis vertebra. So one of the things that we want to do to decrease that anterior pelvic tilt is to relax the hip flexor muscles. Those are the muscles in front of our body that pull our pelvis forward. One of those hip flexor muscles is the rectus femoris. And why this ties into leg extension, we're going to show you right now. When we perform a normal leg extension exercise at the gym, when we sit down, we get in the leg extension machine, and we extend our knees by bringing our ankles out against the resistance pads, we're using the quadricep muscles. This is an isolation exercise for the quads, but we're using all four quadriceps. Remember, quad, four muscles. The most important one of them as it pertains to spondylolisthesis and anterior tilted pelvis problems is the rectus femoris. It comes from the top of our pelvis down to our kneecap and inserts in the tendon right above our knee. And because of spondylolisthesis patients and clients that I've had, and most of them around the world, have this anterior tilted pelvis, according to a lot of the research that's out there also, what we find is that when you use your quadriceps, not only in a leg extension, but walking, running, climbing stairs, jumping, squatting, lunging, you're more apt to use much more of the rectus femoris muscle than some of the other quadriceps. The balance of the quadriceps actually becomes off because of these tight hip flexors. They become the dominant muscle in your body, and you're so used to using them that you'll use them for something like an isolation exercise with leg extensions also. So what we can do to decrease that is we can learn to relax the rectus femoris while doing leg extensions, which will help you to use more of the other quadriceps, and in the long run it'll help to relax those hip flexor muscles so they don't become as dominant. So the way we're going to do this is we're simply going to, before we start putting pressure with our ankles into the pads of the machine, we're going to press the bottom part of our thighs, just above our knee, down into the seat of the leg extension machine. As I do that, what you'll notice is your glute muscles, your buttock muscles will start to fire or get tight. You can put your hands back on your buttocks as you do this, and you'll notice a difference. As opposed to a normal leg extension, if you push the bottom of your thighs down with a good pressure into the seat, you'll notice your buttocks start to harden. Well, that's going to be important for two reasons. Number one, when we push the buttocks down and the glutes contract, it relaxes the hip flexor muscle. So inherently, the center of your thigh is not going to be as tight as if you did not do that. You're going to notice a difference. You can actually palpate that on the rectus femoris muscle. The other thing is that many people with an anterior tilted pelvis not only have tight hip flexors, but they have weak glute max or buttock muscles. When the glute max is weak, it creates a compensatory overcontraction of the lower back erector spinae muscles, the superficial muscles in the back, which then arch the back even more and help to drive that spondylolisthesis vertebra forward. So although most people are not thinking leg extensions feed into my mechanics and how the stresses add up in my lower back, it's very important. So by keeping the thighs down, pushing down, not the upper thighs, remember, but the lower thighs, just above the knees, if you keep that pressure down, not only as you extend, but as you bend the knees all the way through the set, what you're going to notice over time is that you'll be developing your quadriceps in a way that's much more balanced. You'll be decreasing the participation of the rectus femoris muscle, and you'll be increasing the participation of the other quads like the vastus lateralis, medialis, and intermedius. And over time, this is going to be one of the many types of things you can do to help rebalance your mechanics, because without this, many activities feed into poor mechanics. If you're going to the gym, you don't want to be strengthening dysfunction. You want to be strengthening proper function. So learning how to modify and tweak exercises so that they feed into better mechanics only serves you better. The way you do your leg extensions, the way you do your squats, your lunges, or your leg training, or any exercise of the trunk or lower extremity is inherently important because it gives your body an opportunity to strengthen weaker muscles, inhibit overactive muscles, neurologically wake up and improve motor patterns or movement patterns, the way you move, and stability patterns, the way you stabilize your spine. So plug this one into your training if you have an anterior pelvis with spondylolisthesis pain, and you'll notice this exercise will feed into others that will help you to start rebalancing out the mechanics, thus decreasing the stress on your body. Because if you start practicing what you're doing in the gym with your body, it's going to be more likely to transpose over to other areas of your life. Remember, if you've got an overactive hip flexor muscle like the rectus femoris, it's not only being used more with leg extensions, it's being used with every step you take during the day, 5,000 to 10,000 steps a day. It's being used when you bend down and squat to pull something out of a cabinet. It's used when you climb up the stairs, when you run, all day long. So the more you can train this balance and strengthen these weak muscles and inhibit the overactive ones in the gym, the more likely you're going to be helping to improve your mechanics, the stress on your lower back, and what you'll notice is your body will be able to start now healing because it won't be subsequently irritated every time you go to the gym, and proper mechanics will start feeding in to alleviate your problem. If you like this video on spondylolisthesis and leg training, check out our channel, subscribe to it. We've got a lot of great videos out there to help you. Questions or comments, as always, write in. I'll do my best to answer. And remember, if you're looking for a great program to help with your spondylolisthesis pain, develop a program. A body analysis is included in it. Check out the Fast Track program for spondylolisthesis. It has all the stretches, all the exercises, all the analysis. It takes you from developing a neutral spine that's unique for you and your particular mechanical situation, all the way up to choosing which exercises are good for you, avoiding which exercises are dangerous for you, and get your back into shape while helping to heal your lower back. I hope you enjoyed this video on leg extension training with rectus femoris participation for your lower back spondylolisthesis pain.